This is a part 2 lecture on peptic ulcer disease. First, we're going to talk about the histamine receptor antagonists, uh, cimetidine, ranitidine, famotidine, and nizatidine. So that's Tagamet, Zantac, Pepcid, and Axid. So these are the first choice drugs for treating gastric and duodenal ulcers. They promote healing by suppressing the secretion of the gastric acid. All of them are equally effective, and serious side effects are uncommon. How do they work? Um, Absorption is slowed if taken with meals, so you don't want to take a cimetidine with a meal. It can cross the blood-brain barrier, but it's with much difficulty. So then it may cause some CNS side effects if it can cross. So the therapeutic uses for gastric and duodenal ulcers, for GERD, for Zollinger-Ellison syndrome, which is where there's a gastrin-secreting tumor or hyperplasia of the islet cells um, that causes overproduction of gastric acid, and that results in recurrent peptic ulcers. Can be used with aspiration pneumonitis and for heartburn, acid indigestion, and sour stomach. What are the adverse effects? You can have an anti-androgenic effect, CNS effects, pneumonia, and with an IV bolus, which you won't be doing outpatient, it can cause hypotension or dysrhythmias. Drug interactions with warfarin, with dilantin, with theophylline, lidocaine. Again, antacids can reduce absorption. And if you do have to give them, want to give them an hour apart. Moving on to ranitidine or Zantac. Many of the same properties as cimetidine. It's considered a little bit more potent with fewer adverse effects, fewer interactions than cimetidine, because cimetidine was the first one out, and usually the first one in a class of medications has the most side effects, and as they go along, they tend to be able to get rid of some of the adverse side effects and drug interactions. So the adverse effects, significant ones, are uncommon. They do not bind with the androgen receptors as cimetidine did, and elevation of the gastric pH may increase a risk of pneumonias because of aspiration. Therapeutic uses are for short-term treatment of ulcers, prophylaxis for recurrence of a duodenal ulcer, the treatment of the Zollinger-Ellison syndrome, and treatment of GERD. Next, we have famotidine, which is Pepcid. And if you think now, all of these are now over the counter also. The actions are similar to those of ranitidine. One side effect that I did notice with ranitidine that I didn't mention before is that, headache can be a side effect, and I noticed that more patients will complain of headache with ranitidine than they tend to with any of the others. Therapeutic uses for Pepcid now include the short-term treatment, prophylaxis, the treatment of the Zollinger-Ellison, the treatment of GERD, and with the over-the-counter preparations you have for heartburn, indigestion, sour stomach. Even though all of these are over-the-counter that I've discussed so far, certain, with a lot of the insurances, you still can get them as a prescription medication, because they certainly are going to be much cheaper, and the insurances, unless it's totally only over the counter, will pay for this as opposed to one that's still prescription only, or they prefer to pay for it. Adverse effects, again, no androgenic effects, and again, the risk of pneumonia caused by the elevation of the pH. Next, we have the Axid. Uh, Again, same actions as ranitidine and famotidine, and uses for the ulcers, GERD, heartburn, indigestion, and sour stomach. Now we're going to move on to the proton pump inhibitors. They are the most effective for suppressing secretion of gastric acid. Um, Therapeutic uses are short-term for the ulcers and also used for GERD. They are usually well tolerated. Selection is based on the cost and provider preference. Can increase the risk of serious adverse events, including fracture, pneumonia, acid rebound, and C. difficile. So first, we're going to just talk about omeprazole, which is Prilosec. It was the first available PPI. It inhibits the gastric secretions, has a shorter half-life. It's used short-term and can be used prophylactically for patients that are in the ICU um, if they have other additional risk factors. Adverse effects um, with short-term use usually inconsequential, but if you do headache, GI, pneumonia, the fractures, hypomagnesemia, rebound, acid hypersecretion, C. difficile, gastric cancer. So when you're on these long term, you usually have to end up getting um, EGD to make sure you're not developing any adverse reactions. Next, Nexium, nearly identical to the Prilosec. Um, Same, it can be used for erosive esophagitis in addition to the GERD, the ulcers, H. pylori, and the prophylaxis of NSAID-induced ulcers. Side effect profile is the same. Here's added flatulence, nausea, the diarrhea. Next, we have Prevacid, very similar to omeprazole also, with the same side effect profile. Dexilant, it reduces the gastric acidity. It's used to treat and maintain of healing erosive esophagitis and symptomatic GERD. And it again has the same adverse effects profile. Rebeprazole is much like the rest in action and use and adverse effects. It's used for H. pylori, eradication, duodenal ulcers, GERD, and for the Zollinger-Ellison syndrome. And it acts like the others in reducing gastric acidity. You have your Protonics, which is again similar. It treats the GERD and the hypersecretory states. Adverse effects if it's taken orally, diarrhea, headache, dizziness. IV forms, which you wouldn't be giving in the outpatient setting, are listed. And long-term, same problems as all the rest. Some other drugs that are used for ulcers can be the Carafate, Cytotec, and antacids. One thing about Cytotec that you'll notice, that is what you'll see with some meds. It's used in combination with the Celebrex so that that NSAID does not erode the gastric lining, because giving the Cytotec then helps to protect that lining. So with the Carafate, it creates a protective barrier for up to 6 hours. So you want to use it with acute ulcers and for maintenance. Adverse effect, constipation, but that's very low, only 2%. Drug interactions are minimal, but you don't want to use with antacids. Side attack is used in the prevention of gastric ulcers, and I just talked about that from long-term NSAID therapy. That's where your Celebrex comes in. Um, Side effects, dose-related diarrhea, abdominal pain, contraindicated in pregnancy. I know we're not using the categories anymore, but it was a category X because if it is used, it can initiate abortion of the pregnancy because Cytotec is used to help induce pregnancy. I mean, to induce labor um, on a regular basis in the L&D area. Antacids, they react with the gastric acid that's already been produced, and so they changes that to a lower acidity, which helps to reduce destruction and helps enhance the mucosal protection. And except for sodium bicarb, it does not alter the pH, but you must be careful in use with patients with renal impairment. Adverse reactions, you can have constipation if it's an aluminum hydroxide. If it's in a magnesium hydroxide, then it would be diarrhea. So it all depends on which one you buy. And you have to be careful of sodium loading. So if the patient's on a sodium restriction, you have to watch which antacid, if any, you can use. And there are drug interactions, can be drug interactions with some of the H2 blockers and with the carafate. And as I kind of mentioned earlier, you have the aluminum compounds, magnesium compounds. You do have calcium compounds, as your Tums, sodium compounds. So your a magnesium compound will be melcomagnesia, which is rapid acting. It's just one that's very popular. That one would cause the diarrhea. It's used in combination with aluminum hydroxide, which causes constipation. Avoid in people with undiagnosed abdominal pain. Frequently used as a laxative. And be careful with patients with renal failure. The aluminum preparations are slower acting, have a longer duration, rarely used alone, can have significant amounts of sodium, which can be a problem. Again, cause the constipation, and watch their use with tetracyclines, warfarin, and DIG. The calcium carbonate compounds are rapid acting. You can have acid rebound, constipation with these. Can be overcome if you mix it with, of course, the magnesium product. You can have a lot of belching and gas, and they don't taste good at all. Very chalky. And then sodium bicarb is helpful for treating acidosis, inappropriate for treating peptic ulcer disease because it has a brief duration, very high sodium content. It can cause alkalosis, lots of gas, belching, can exacerbate hypertension and heart failure, and can cause systemic alkalosis if the patient has renal impairment. And these combination packs are just packs that are used for H. pylori. So you have a Helidec pack, a Pylera, and a Prep pack. And they're kind of they're usually Prep pack because you use Prevacid in it. So become already set up to go with all the pills in there, and the patient is just instructed how to take those packs. Those are still available, but if we're going to use, and you may have to add to it if we're going to do a quadruple therapy. Question number 1, the patient is prescribed Tagamet and an aluminum hydroxide or Maalox for treatment of peptic ulcer. What should the nurse teach the patient to do? And that's D, wait an hour between the two. They should not be taken together. Question 2, the patient is prescribed amoxicillin and tetracycline to treat peptic ulcer. When instructing the patients, what should you tell them? And the answer is B. You want to destroy the bacteria that are causing the ulceration. That's what's happening while you are giving the 2 antibiotics. Question 3, which medication is used to promote gastric healing and promote a protective barrier? And the answer is D, the Carafate. And that is it for this presentation. Thank you.